this afternoon.
My name is Karli Rikli. I'm a physical therapist. I work at Elevate Sports Enhancement and Rehabilitation. Just a little bit about myself. I have been have transformed into doing more of a concussion and vestibular rehab. I did spend a few years in Europe, not doing physical therapy, but just took some time off and spent a couple years over there. I am originally from Nebraska, but moved back to Colorado 12 years ago, so I've been practicing in the Springs for the past 12 years. I do have a background in athletics, played basketball and volleyball, track, all that good stuff. So physical therapy has been a great avenue for me to pursue my love for athletics, sports, but also helping others achieve their goals and what they want to do. So it's just been a good fit for me. So just a little bit about what we do at Elevate. We do traditional physical therapy. Like I said, my background has been in outpatient ortho. So I've seen everything orthopedic-wise, neck to toes. I've seen everything from neck pain to joint replacements to ACL to rotator cuff repairs to just I hurt my back, hurt my neck in a car accident, all of those things. So kind of seen it all. Bunionectomies, you name it. I've seen it. I incorporate both manual therapy and corrective exercises in my approach. So not just doing manual therapy, but also doing corrective exercises to help accomplish our goals. We do see both pre and post-surgical patients. So after surgery, we do a lot of post-rehab. We do some pre-rehab as well, so getting them ready for surgery. We do sport-specific strength training. We do see a lot of hockey players where I work. We're connected with the Rampage Hockey Club, so we do see a lot of hockey kids that come in and do sports rehab and sports enhancement stuff with us. I also do trigger point dry needling. I talked to Heather a little bit about that earlier. Have any of you been dry needled or, yeah? What do you guys think of it?
Great.
Yeah? Worked pretty well for you. So Heather was just saying that some people are like, yeah, let's do it. I'm all about getting needled. And then some people have this fear of needles and they're like, you have to work themselves up to getting it done. And then other people are kind of middle of the road. So.
Welcome to my career.
Yeah. Yeah.
I used to pay a girl to torture me for an hour.
Really?
She did my cast for an hour.
Oh, you're brave.
Like 15 minutes in, I'm just like staring at the clock like, please, Lord, no needles.
You're brave.
It works.
Yes, it does. It does. It's not the end all be all, but it is a good tool to have. So, does anybody know the difference between acupuncture and dry needling? That's a question almost 90% of my patients ask me when they're getting dry needling.
Philosophy is what I've heard. I don't know if that's accurate or not, but that's what I tell people.
Yeah, it is a different philosophy. We actually use the same needles, but the acupuncture is based off meridian lines and energy systems, versus trigger point dry needling is based off where the muscle is tight, called a trigger point. That's where we're going in. So trigger points can cause referred pain, but we're actually going into the trigger point where the muscle is tight to release that and hopefully decrease pain and improve function for them. So, okay, so we do traditional physical therapy, but what we specialize in is brain rehab. So our goal with the brain rehab is to improve neuroplasticity, which is the process of repairing damaged pathways between brain cells and helps promote the growth of new neural pathways. So we always tell our patients the brain has amazing capacity to heal itself. You just have to stimulate it in the right way to get that neuroplasticity to work and to grow. So we also do sensory integration, which is the brain's ability to communicate with senses both internally and externally. So that's kind of what we do. I'm going to go into this a little bit more in our next slide here. But we also do vestibular rehab. And I brought my little model here. So vestibular component is inside the ear, behind the eardrum, and this is the cochlear vestibular membrane apparatus. So this is cranial nerve 8 that innervates it. And then the cochlear component is what we hear with. I don't address that so much. But the semicircular canals is where I'm more concerned with. Is there is what we call crystals or I can never say it.
Otocondia.
Yeah, thank you. And they detect motion. So they're detecting when when we're traveling in space, when we turn our head, that type of stuff. If there is a disruption in the vestibular system, other parts of our body compensate for that. So our vision, like you were talking about, our vision is 70% of what we interpret. So our vision gets on overload if our vestibular system is not functioning properly. Also, the brain, our hearing, our proprioceptors, or our joint receptors, all are functioning. And what happens then is when they're functioning more than what they should be, then it causes increase in energy and people get really fatigued. So we see most of our patients come in and they're like, yeah, I'm just fatigued all the time. And I'm like, yeah, it's because your other systems are in overdrive. Also, we have our brain has a capacity of what we can tolerate stress. If our vestibular function is not working properly, that increases our stress level. So normally we wake up in the morning and we're here and we have this much room to tolerate stress. However, if our vestibular system is not working like it should be, we're up here and then you only have this much room to tolerate stress. So what ends up happening is other body parts, our brain and our vision, are compensating, and what ends up happening is people come in with headaches, loss of memory, difficulty concentrating and focusing, that type of stuff, because their brain isn't doing that. It's so worried about where they are in time and space that it's not working correctly. So we see that a lot with our patients. I'd say almost 80% of people that come in that see me with brain or concussion type symptoms have these complaints: the difficulty focusing, difficulty processing, multitasking, that type of stuff. So we also do dynamic balance exercises. So once we've kind of corrected the vestibular system issues, we do different things to help improve the sensory integration and to get their brain to trust the vestibular system again. So we do things like eye tracking exercises with them, such as just traditional pursuits. So taking a pen or your finger and having them just track both horizontally and vertically. We retrain the VOR, or vestibular ocular reflex, which is a reflex that keeps our eyes steady when we move our head, either sideways or up and down. So for every degree that we turn our head, our eyes go the opposite direction the same degree. So like when we're running or going like this, we can still see because the vestibular ocular reflex was working. But we see a lot of times in concussions that gets thrown off. So we do help kind of retrain that, as well as just working on reaction times and balance training. So what is Hdbr, or high definition vestibular rehab? So at Elevate, we have a gyrostem. It's a multi-axial rotational device. Has anybody seen one? I know John has. Mm-hmm. You've seen one.
I've been in one once.
You have been in one. Yeah, they're kind of crazy.
It's a little trippy.
Yeah. So basically, it's a chair, and we strap people in. It's a 5-piece harness. We get them all strapped in, get their feet strapped in, and it moves in multiple directions. It twists, it flips if you want it to. It goes different speeds. It rotates. All these different things. We use it for a couple of different things. After we do our initial evaluation and determine where some of their dysfunction is coming from, we do use it to retrain or to realign the crystals in the ear. We have set up so it mimics the Epley maneuver. I know a lot of people, you've heard of that. But basically in the inner ear, in the ampulla, at the ends of these semicircular canals are where the crystals are supposed to be. Sometimes they get dislodged and they end up in the semicircular canals themselves. And when that happens, that can cause dizziness and other problems. So when they come to see us, we address that first. We can do it in the chair. We can also do it with the Epley maneuver. But in the chair, we have it designed to work both the posterior and anterior canals as well as the horizontal canal to reposition those crystals. So we usually start with that if it's appropriate. Then we also use the chair to help what's called active brain recovery. So that's just the application of a specific and precise stimulation to the brain through all the systems, the vestibular, the proprioceptive, and the visual system all at once. So we're retraining all three when they're in the chair. So what we do is they get strapped in the chair, we give them a laser. And there's different targets. I don't know if you can see them, but these are the targets, kind of, there's 4 of them in the chair. And as they're going, they hit those targets with the laser. And then after we warm them up doing that, then we have them do cognitive tasks along with it. So we may have them come up with as many animals as they can, or things that you see in a grocery store, or different tasks, and they do that. So we have them, first we start in their dominant hand, so kind of their right hand, or whichever hand is most dominant. Then we switch it to their left hand, so they're getting the cross stimulation, cross activation. We have them do both hands, and then we have them do 2 lasers where they're doing the right and the left hand, and I'll have them do tasks such as like names with your right hand, boys' names, with your left hand, girls' names. So they really have to think while they're in the chair, and we're trying to get, the goal is to get the neuroplasticity to activate. So we're trying to find that sweet spot, so it's not just the same protocol for every patient that walks in the door. The chair, we can adjust the speeds, and so based on their symptoms, we're doing it at different speeds and getting them going at different paces, depending on where they're at. So how do we determine someone's plan of care? So when someone first walks in the door, I do a history, subjective history, and an evaluation with them. A lot of patients that we see that come in have been in car accidents, they were post-concussion type syndromes, that type of stuff. So I do a full history and overview with them, plus a kind of a neurological exam, which includes, I'm going to just demonstrate this Fukuda stepping test. So can I get a volunteer?
Kevin.
Kevin. Awesome, thanks Kevin. So I'm just going to have you stand here, Kevin. Face me here.
Okay.
And what you're going to do, Kevin, is you're going to put your arms out straight in front of you, and you're going to try and march in place, but close your eyes. You're going to do this for about a minute.
I don't have that kind of stamina. Brings me back to my time in the army.
Kevin is looking good. So,
Yes, the zombie does. Okay, take a break there, Kevin. So what we're looking for is to see if they rotate. You can open your eyes. And anything over 30-degree rotation is considered a positive test. So it's not just a conclusive test in and of itself, but it can help with other testing. And a lot of times when they rotate to one side, it gives us an indication of which ear is problematic if they have a vestibular dysfunction. So,
Am I dysfunctional?
no, you actually did really well.
Cool.
I'm pretty solid. I was watching. You did really good.
Yeah.
I've seen
I
people
get
like,
people literally. Yeah, they really rotate on that. So we do that. We also have a computerized balance assessment where we put people on a balance platform, and we do that on a firm surface with their eyes open, and then we do a firm surface, eyes closed, and then we put them on a foam. So it's more unstable, and then do eyes open and eyes closed on that. And some people aren't able to do it on the foam with their eyes closed. It's just too much. So then it videos, it's all computerized, and we can get a better idea of where they are with their balance. And then we do Vng testing. So we put these goggles on people, and we're monitoring their eyes, and we're looking for nystagmus is what we're looking for. So nystagmus, as you know, is when the eyes do this little twitch. And it's a miscommunication between the visual system and the brain. So we also do eye testing with them on a screen. So we do smooth pursuits, saccades, and different tests with that. And then we also put them in a Dix-Hall pike position and some other positions to test the horizontal canals on their sides and rolling and that type of stuff, and monitoring their nystagmus, so we get a better idea of how their vestibular system is working, as well as if there's miscommunication between the vision, their eyes, and the brain. And that kind of helps us determine their plan of care. So what can our therapy help with? So traumatic brain injuries, post-concussion syndrome, which is majority of what I see is post-concussion syndrome, either after sporting accidents or car accidents. I've had some people that fall off their bikes and hit their heads, you know, things like that. We treat vertigo. We've also treated autism and Asperger's, headaches, migraines, balance issues, insomnia, Parkinson's, cerebral palsy, MS, PTSD, anxiety, and depression. So this is just a little testimonial. This is a lady that came to see us after a post-concussion syndrome after a car accident. A little over a month after my accident, I remember being so worn out and depressed all the time. Although my injury wasn't visible to the eye, it was there. I had moments of darkness because it was so hard to do everyday tasks and I felt so inadequate. I had a lot of health issues and was unable to work to do the things I enjoyed. So I fell into a deep depression. I think anyone would. Now I've been 2 months seizure-free, medication-free, and just pain-free since beginning Hdbr therapy. Turning Point worked with me diligently to figure out the root of the issue and found a way to fix it. They've given me my joy, drive, and tenacity for life back. They've saved my life and I will never be able to express my gratitude. So this is just a little bit of follow-up. After we do the gyro stem, we also do the dynamic balance exercises in the gym, which are a little bit more functional. So we get people doing different things out there. We have a maze that we run people through with lasers. Sometimes we'll put a head laser on people, have them run through the maze that way. While they're doing the maze, we have them do cognitive tasks. We also have a Smart Fit, which is this machine, and it's a series of lights that pop up and people hit them trying to do different tasks and problem solving on there. And we also incorporate different balance devices. So you can see he's on a BOSU, just depending on their balance level. So we're really incorporating all three systems like we talked about, the visual, vestibular, and the vision all at once. So that's pretty much it. Does anybody have any questions?